My mother is a nurse, and she kind of encouraged me to go into medicine. I had an elective rotation in ENT because I thought it was interesting, at least the anatomy, and I just kind of fell in love with it. Some patients need to come in for just one thing and it gets resolved, and I don't see them for another few years, but it's always nice when they do pop in again and we can catch up. But then, yeah, there are a few things where I do have to see patients on a regular basis, and it is really good to establish those relationships and get to know them. At that visit, I really want to accomplish what they're coming in for. In ENT, it's really specialized. So even though I am in general ENT, it really could be like a very specific, like voice changes or earwax, ear infections, nosebleeds. So we're really focusing in on what they're coming in for. And then, we obviously focus on, neck up as a whole in their first patient encounter as well. We see a lot of ear patients, and then, a few more coughs in the winter, or like chronic cough can sometimes come in, and we will perform like a flexible laryngoscopy and take a look at the vocal cords and make sure everything looks okay. And, seeing everything, a lot of times we can play that video back and show the patient and kind of explain in detail what's going on, and seeing them for themselves can sometimes give some reassurance as well. It feels really satisfying to get to make them feel so much better and have them come in and say, whatever I was coming in for is completely gone. That is no longer a problem for me. That's always good to hear, that I've kind of solved an issue. Or that, with like earwax cleanings, for example, it's very uncomfortable, and then someone comes in and gets it fixed and they leave, completely cured, and you don't really get that kind of leaving and feeling satisfied with, every single complaint that comes in.